Hey y'all. I just got damn it. Allergies are affecting more than I thought. Yes, Daddy. I made the mistake of opening the curtains in my bedroom so now he can see when the kids go from school and walk down the sidewalk to go to the So he says, whoa, to everybody. You heard me say your name, didn't you? You heard me say your name, didn't you? You heard me. Going back? Or are you going to come over here and say hi? You can come say hi? Come here. Come here. Come say hi. So, I just got a email. Hi. And say hi. Is that you? Mwah. Thank you, baby. Thank you, baby. Look. Off. Good boy. All right. The disconnect, reconnect started. Quick. I'm going to try and do this real quick. Fucking A. This shit's got to stop. AI upgrades in hospital rooms enhance patient care and communication. How is AI in hospital rooms now? What the frig? Hey, Elmo! What's up, my bud? Where the hell you been, man? I know, life. Hopefully, things have steadied. Please, Jesus. Okay, AI upgrades in hospital rooms. Hello care. The fuck? Okay, so, communication. Alright. Yeah. Communication. Virtual monitoring tools. 15 hospitals. 15 hospitals has there's AI in 15 hospitals now here. Fucking blue state. Major new upgrade soon. So there's already AI in the hospital rooms, which I didn't know. And now on top of it, there's something new coming out. Interaction between patients, families, and providers. I'm curious about this. But while also driving efficiencies that will improve patient care and satisfaction. Okay. Florida-based Solaborate. Hello Care. It taps into hardware, including cameras with computer vision, speakers and microphones perched on televisions in each patient room. Excuse the thought of me? They already exist in many UC Health inpatient and emergency department rooms. Great. Leaders plan to install them in the remaining rooms over the next year or so. You don't have to go outside. I'm not mad, baby. Well, maybe I am a little bit. I don't know. Penny, when I get loud and it's not laughing, sometimes even laughing, she wants to go out. She doesn't like it. The biggest difference between HelloCare and today's remote patient monitoring systems lies in HelloCare's AI-powered software, which will soon let clinical teams devote more of their attention to pressing patient needs. What? Okay. Our HelloCare... Oh, is Queenie here? No, Queenie's not here. Jay, you haven't been weird. Oh, no, I expect... I live in Colorado Springs. This is a blue state. This is a kind of more red than purple city because this is where all the military is. But Oh, and I haven't silenced my phone. I'm expecting a phone call. But our Hello Care partnership. I wish Queenie was here so she could weigh in on this because she's a medical professional. Our Hello Care partnership is significant and brings multiple I'm not having a good brain day today. Well, it's not a bad brain day, just not top of the line for me brain day. Our Hello Care partnership is significant and brings multiple solutions that are part of our efforts to bring AI into clinical care. UC Health's Chief Medical Officer and Chief Innovation Officer, Dr. Richard Zane. We want to allow humans to work at the top of their scope and focus. Top of their scope? How about top of their abilities? Scope? What the fuck? Why would you use that word in reference to a human? A machine, yes. Human, no. And focus on the tasks, interactions, and decisions that make again. What the fuck, OBS? What'll it bring to UCL patients and providers? I know the OBS has been fucked with this disconnect, reconnect bullshit, and I haven't figured it out yet. Here's how leaders expect Hello Care to work. Enabling easy interactive communication between family members, patients, and doctors. It'll feel like in-room Zoom meetings, complete with the ability to share medical and other images. It provides for telehealth check-ins with on-site doctors or off-site specialists. Why would you need Zoom when the medical people are in the room and you've got AI in the room? Red flags here for me. Don't like it. Can include remote interpreter services on screens. Should need remote interpreter services if you're in the hospital. Just saying. Generally speaking. During emergencies like a stroke, pet specialists can direct remote care and augment clinical expertise at UC Health's rural community hospitals. Possible benefit, yes. Did not mention AI specifically. Assisting nurses with virtual sitting and patient monitoring. UC Health Virtual Health Center already monitors patients for deterioration and sepsis. Duh, that's their fucking job. With Hello Care, nurses and providers can use AI monitored video to help keep a close watch on patients. They also plan to integrate the use of wearable devices in the future that can track patients' vital signs. There already are those. They're just not integrated with AI. Experts at the U.S. Food and Drug Administration still need to approve these devices. Hopefully, it's a very, very thorough frigging process. Please, Jesus, let it be thorough. In the near term, not the one I needed. In the near term, Hello Care's AI tools can assess vital issues like whether a patient who is at risk for bed sores has been turned in the previous 2 hours. How is that not tracked already? Duh. Or if patients shift their positions on their own, the Hello Care system resets the clock automatically. Similarly, which means that there's going to be covers on mattresses that'll sense that. Similar to what I have right now. It's not AI though. Similarly, Hello Care can confirm whether providers have washed hands when entering the room or alert nurses if a patient has stood up and is at risk of falling. Confirm whether providers have washed hands when entering the room? How in the... what? Huh? Assisting with automated documentation. Nurses spend 25 to 40% of their time adding documentation to patients' records. Patient care, quality, and regulatory requirements, not to mention the rise of the electronic health record, have roughly quadrupled in the documentation burden facing nurses in recent decades. Understood. That's part of something else that the VA is dealing with. Chief Nursing Executive. AI, cameras, and computer technology can not only improve patient safety, but can also reduce the documentation burden and other burdens at the bedside that are shifting nurses and caregivers' attention from the patient care where they really want to spend their time. One example of possible future Hello Care. Now, I haven't read this. I read and I wanted to react, as I usually do, in real time to this. One example of possible future Hello Care automated documentation. If I'm going to the bedside to start an IV, I can say Hello Care words and do that documentation. Okay, yet with the fucking OBS. Enabling digital whiteboards. Okay, I see that. Because OBS is